I would have to present to you is a request for a hotel tax / tourism grant. You each, I believe, had an opportunity to look over the proposal. This is a new request. It is time sensitive since it is directly related to COVID-19. And as you know, this was something that was originally proposed by Larry Bowman, who is the former president of the Lebanon Valley Chamber of Commerce, and would be working with Lebanon Family Health Services on a concept to utilize some of the tourism funding to purchase food from local restaurants, as many as possible, and then distribute those meals to local health care agencies, first responders, anyone on the front line, essentially, to the best of their ability. You've all had a chance to read it. If you feel it's worthwhile, Mr. Chairman, I can read the pertinent parts of the application.
Sure.
All right. So this grant would be utilizing an allocation of room tax revenues from the Lebanon County Commissioners to fund an initiative aimed at supporting and providing a morale boost to frontline medical and other healthcare personnel in the county who are helping to pull Lebanon County and its residents through the current coronavirus crisis. The initiative would at the same time be aimed at helping to support the county's restaurant industry, which is an important part of our tourism sector that has been very hard hit by the closures and severely curtailed operations. The focus would be to demonstrate the community's support and appreciation for the efforts of the medical, nursing home, and medical transport professionals during this challenging period by purchasing and delivering to those medical and nursing home facilities and offices easily packaged individual meals for their staffs. The meals would be purchased from as many Lebanon County restaurants and delis as possible to have the staff and resources available to prepare the quantity and quality of sandwiches and meals needed. They would like to launch this initiative as soon as possible and are prepared to begin identifying which facilities and offices are willing to have meals delivered and which restaurants and delis are willing and able to meet the food requirements. They would also plan to contact organizational partners who may be able to assist in providing volunteer services for this effort, as well as an organizational entity willing to receive the funding and pay for the meals purchased from the participating restaurants. As I mentioned a moment ago, that would be Lebanon Family Health Services, has evidently stepped up for that. The initiative was first brought up, I guess, or first thought of when Mr. Bowman had a conversation with Mike Kuhn from WellSpan Good Samaritan Hospital and Kim Kreider-Humble from Lebanon Family Health Services. Both Mike and Kim mentioned several individuals brought small quantities of meals to the staffs over the past week or so, and that these were not only greatly appreciated but had an uplifting effect on the staff's morale. Any such organized efforts to provide meals for the staff at Good Samaritan and other facilities would undoubtedly provide a huge morale boost to these frontline medical and healthcare workers. He would keep all of the documentation for any funds expended and hope that the commissioners will see the potential benefit of the initiative for the county's frontline medical workers and as well as the restaurant industry.
I'd like to, what I heard you say in the beginning was what I was hoping for, and then when it was read, it had a slightly different tone. Frontline workers to me would include people like our 911 telecommunicators and our COs down at the prison, as well as Renova Center. And the way it's worded in the letter, I don't think it includes them. Could we amend it to include those particular people?
Yeah, I suppose you could. Yeah, of course you could. Medical, home facilities, offices, frontline medical, other healthcare. Yeah, I'm not sure if, how broadly they're willing and able, but you could certainly make that known, and that could be part of the award, the language in the award.
I would make a motion to include them and adopt the letter that we received for the grant request. I understand we'd have to waive the match though, because I had suggested perhaps asking the public to make a donation and matching that, but Larry said he didn't think that they would be able to track all that. So I guess it stands as it was presented, except for,
As far as the match goes, in other grants in the past, you have allowed in some instances for the in-kind effort, the value of the effort, if you were to attach a price or a cost to the time of the, for example, Lebanon Family Health Services and others putting into this, not that you're compensating for that time, but the value of it basically could stand as an in-kind match toward the amount. And as far as the amount goes, I think initially Mr. Bowman was requesting $10,000. In speaking with each of you, there's some thought, I guess, of possibly increasing that number to be able to just get this as far and wide as possible.
I think that was because we thought if there was a match, we could take $10,000 and multiply it to 50,000 if we put up to 25,000, but that's not what they were looking to do, and that might extend the period too long. So I thought that he just wanted the proposal as he sent it in for the 10,000.
No, I was inclined to make it 25, as was suggested the other day. I think that, and if they don't use it, they don't use it. They'll obviously it would be returned to the fund. So if you would include that amount in your motion.
So this would be on a reimbursement basis. They wouldn't get the money all up front, or would
No.
we release it piecemeal?
In my thinking, we would have it available. They may want availability of some of it to use, but I'm sure they'll work that out with the restaurants. I have total confidence in people like Larry Bowman and Kim Kreider-Rumble, and they've also reached out to Brooke Smith with the United Way. So we have folks that are professionals in the field of public service and service agencies. So I think we should put our confidence in them.
I agree.
To do what needs to be done.
Is the Chamber of Commerce involved in this as well? I haven't heard any confirmation on that.
Not to my knowledge. I think they're going to reach to anyone that's willing and able to help to get this done, to do the best job.
Well,
But the funding is going to the Family Health Services because they're the nonprofit that can accept the grant.
okay. Well,
Let's put a motion on the floor and see what happens.
yeah, I already did make a motion. He's asking me to amend my motion to up the ante from 10,000 to 25,000. And so, I guess if that's not overwhelming for them, if they still only want the 10,000, then I think that's what we should do, but we can at least have the option to go up to 25,000. That would be my amendment.
I'm comfortable with that. I'll second the motion, Mr. Chairman.
All right, so it's up to 25,000, but we're going to cut a check for the 25, and then if they don't use it, they'll reimburse us. Is that so they'll have the money available to them? Okay, that's the understanding. Any other comment?
Is that allowed? Would we be violating any tourism grant protocol from the state? Can we do that if we don't have receipts? Isn't it normally reimbursable? So should we do smaller amounts, like 10,000 at a time?
I'm going to leave that entirely up to the board. I mean, it has nothing to do with any of the state law, as you mentioned. That's very, very broadly written to allow counties discretion.
Okay. I wanted to make sure we didn't get in the pickle.
Yeah, really. I think we want to make this as simple as possible for Larry and the folks that are going to be working on this. So I would might be inclined to give them the 25, and if they don't use it all, entrust them to return that money to our tourism fund.
And I have been assured that they will keep perfect records, also records of the hours, the time spent, so that, you know, we don't have to measure that. They will provide us with that as well at the end of the project, so.
Yeah, the record keeping end of it as far as expenditure should be pretty straightforward. I mean, every restaurant's gonna issue a receipt and that's, you know, they're just gonna, won't be tallied up.
All right, well, I think it would be coming at a time that is sorely needed for the restaurants to stay in business and make it through this critical time. So we have the motion on the floor.
We have a motion and a second. The end of discussion. All in favor of the motion, please indicate by saying aye.
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 Opposed? So moved. Thank you.
Okay, and Treasurer Nguyen, is that something we can turn around in conjunction with the controller's office?
I actually do have, normally those checks would go through our payables, which could possibly go with payroll this week, but I also have, or this coming week, but I do have a checkbook for that account. So, I mean, we could do a check directly to them. I'm assuming we just have to make sure we record it properly then.
Okay, we'll work directly with Larry and Kim and get that done as soon as we can so they can get going as soon as they can.
Excellent. Very good.
I just, if I could comment, Mr. Chairman,
Certainly, go ahead.
I just think it's seldom that we have the opportunity to, I guess the popular saying is kill two birds with one stone. Here we're meeting a need and rewarding, if you will, the folks that are out there working against this virus every day, and also to help our restaurants, which are obviously key to tourism. We're doing this at a time when other things in tourism are, you know, would not make much sense to spend money to advertise and things like that, or to promote events that can't be held. So I think this is a wonderful opportunity to utilize some of that money and, as we've already said, to help restaurants stay in business, because we want them to be there when this whole thing is over. So I appreciate the board agreeing to do this, and I'm very glad that Larry initially brought the idea to us.